Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Plateau health authorities draw more people out for COVID-19 vaccinations with more patient-friendly strategy. Maritime University in Delta State to get around COVID-19 and distance restrictions with online learning. And under a sharing deal, Israel to send a minimum of 1 million doses of COVID-19 shots to the Palestinian authorities. Nigeria will begin to access more vaccines for its citizens following the supplementary budget, which has been submitted by the federal government. This is according to Mr. Boss Mustafa, Secretary General of the Federation and Chairman of the Presidential Steering Committee on COVID-19, who appeared before the Nigeria Governors Forum to give an update on the federal government's response to the COVID-19 pandemic. Mr. Mustafa also said the plan to set up oxygen plants across the country is in top gear, with one of each plant to be set up in all the states, while Abuja and Lagos will have 2 plants each. Meanwhile, the NCDC reported new cases last night from 5 states and the FCT. Lagos led Thursday's infection tally, a city which has recorded nearly 60,000 cases and more than 450 deaths.
The face mask serves as a barrier to limit the risk of spread of respiratory droplets from a COVID-19 infected person. The Nigeria Center for Disease Control is asking everyone to wear a face mask properly, covering the nose and mouth, and to wear one to public places. Nigeria recorded 39 new cases of the virus in the last 24 hours, a significant jump from the previous 24-hour cycle, which recorded only 8 cases. 5 states and the FCT are responsible for this rise. Lagos stands out with 34 of the infections, while Rivers, Ebonyi, Ekiti, Jigawa, and the FCT recorded 1 case each. This report includes data from Lagos State gathered over the last 2 days. No cases were reported from Imo, Kaduna, Kano, Ondo, Osun, Oyo, Plateau, and Sokoto. This brings Nigeria's total case count to 167,142. 7 people have also been discharged after testing negative, raising the number of recoveries to 163,535. For 13 days, the number of deaths has been steady at 2,117. The latest update by the National Primary Healthcare Development Agency shows that almost 2 million eligible Nigerians have been vaccinated with the first dose of the vaccine, while more than 730,000 of those vaccinated with the first dose have now received their second dose. In Africa, there are over 5 million confirmed cases and more than 136,000 deaths on the continent. Globally, there are more than 177 million confirmed cases, while deaths have surpassed 3.8 million.
More persons have vaccinated or have been vaccinated with the Oxford-AstraZeneca COVID-19 vaccine in Plateau State. This is as vaccination for first and second dose continues simultaneously. And according to health authorities in the state, more citizens are responding to the call after the initial setback of vaccine skepticism.
More people are coming out to get vaccinated in Plateau State. Authorities are saying this is because the state is being more flexible about its vaccine administration and because of what they call super sites.
We are equally running the first dose for others that were not captured in the first round. So we are running it concurrently. And as well, we have super sites that take care of people that had taken the vaccine elsewhere outside Plateau State that are now in Plateau State because, people travel, there's lots of movement, and people that must have taken somewhere, even outside the country, now they're in Plateau, they will have the opportunity to take their second dose here.
Since the vaccination exercise commenced in March, the state has recorded 3 severe cases of adverse events following immunization, which have been managed.
They were handled and they are all stable. Like one, it's a woman that she suddenly observed swelling in her legs and fever accompanying, so she was managed here in Plateau State Specialist Hospital, and she's up and then she's fine.
3 months after the first dose was introduced, some are just receiving their first jab, a situation which is being attributed to initial apprehension and misinformation as expressed by a resident who just received the vaccine at one of the super sites.
Basically, it's just the nonchalant attitude of Nigerians. I'm part of it. And some rumors that it's not the best, it's going to have side effects.
With the spread of the super sites across the local government councils of the state, as well as the special site created for visitors and people in transit, it is expected that more citizens will avail themselves of the COVID-19 vaccines.
And authorities of the Maritime University Okarenkoko in Warri Southwest local government area of the state are seeking ways to deal with the new normal of virtual learning as a way to deal with the current challenges posed by the coronavirus pandemic. During a courtesy visit by the governing council of the institution to the Delta State governor, it presented an opportunity to solicit support in the area of infrastructure, which includes a fully furnished ICT center within the school premises. Other requests like the completion of the ongoing renovation, remodeling of classroom blocks, construction of additional staff quarters, and the provision of potable water at all campuses of the university.
Everybody was at home. Were you in that work? We have to send our... See, it is only the living that can go to school. Dead men don't go to school. We are making efforts to do virtual studies. We have contacted universities outside of Nigeria that have the requisite knowledge of maritime to lecture our students. They will be in their offices in London, in Jamaica, wherever they are, and give lectures to our students here in Nigeria. We have to just put the infrastructural IT facilities, then we start that lectures. Lecturers in the UK, in the US, they will be lecturing our students here while they are there. That is what technology can do. So we want to tap into such things and let our students get the best.
And we are raising awareness ahead of the 19th of June, which is World Sickle Cell Day, understanding of sickle cell disease and the challenges experienced by patients, their families and caregivers. Joining us right now is Dr. Ajibola Sonda. He is a specialist physician. Thank you for joining us on the program.
Good evening. Thank you for having me.
All right, sickle cell and COVID-19. How does one survive it? Because we've been told that patients with pre-existing conditions are known to have poorer outcomes when it comes to the coronavirus.
Yes, that's very correct. A couple of studies have been done all around the world with patients with sickle cell and COVID-19. As we all know, sickle cell affects majorly the Black race. So most of these studies have done head-to-head with Black people with sickle cell and Black people without sickle cell. Some done in America have shown that patients who have sickle cell disease, who develop COVID-19, are at increased risk of worse illnesses, just like they are at increased risk of some respiratory viruses, such as influenza, and COVID-19, like we all know, majorly affects the respiratory system. But in totality, looking at it, patients with sickle cell are not at an increased risk of acquiring the virus or dying from it from some other studies that were done. So what I would advise patients who have sickle cell is take the general precautions which have been said to everybody, wear a mask every time, proper hygiene, wash your hands when you touch surfaces, avoid crowded places, and as quick as possible, try and get a COVID-19 vaccine, which will reduce the risk of getting severe COVID or preventing you from getting COVID at all. Another interesting dilemma with sickle cell and COVID-19 is that patients with sickle cell have an acute emergency, which we call an acute chest syndrome, which primarily presents like COVID. So patients come in with cough, fever, generalized weakness, and they are very sick. This is an emergency and requires urgent ICU care and immediate exchange blood transfusion. So in this condition, we want to quickly reduce the concentration of the sickle cells present in the individual's body. So it's usually a dilemma in differentiating both diseases. So what we do is patients who come with sickle cell and have any respiratory symptom, I will advise the clinicians who are on duty to urgently get a chest X-ray and as soon as possible, order for a SARS-CoV-2 PCR test. because differentiating both diseases is very key, as one who benefits urgently from an exchange blood transfusion, which is the acute chest syndrome, while a patient with COVID-19 will benefit from our steroids, oxygen, prophylactic antibiotics to prevent a bacterial infection from supervening on COVID, and all the other multivitamins we give. So in totality in Nigeria here, not much studies have been done, but from the little studies that have been carried out here and there has been no significant increase in hospital stay or death rates among patients with sickle cell who get COVID-19. Neither has there been any statistical difference in the propensity for acquiring the virus between patients who have sickle cell and patients who do not have sickle cell. So the same precautions that apply to the general population will apply to patients with sickle cell disease.
Just before we let you go, and this is on vaccination, because there are some people who have the sickle cell disease and are afraid to go out to take the jab. And seeing as we're taking the Oxford AstraZeneca jab here, even abroad, I knew some people who were scared, and they were asking how much of the COVID-19 protein is in the vaccine. So have you come across any, and what's the advice on the kind of vaccines we're getting in Nigeria?
So the AstraZeneca vaccine, people have been saying a lot that it causes clots. But if you look at it head-to-head with other known causes of blood clots, it is way less. In fact, when you compare the vaccine and COVID, the virus in itself, in the propensity to get blood clots, is more than 2,000 times less. So patients with sickle cell are not at risk of blood clots, which is the quote-unquote major side effect that has been touted so far with that AstraZeneca vaccine. So it is safe for patients with sickle cell to get the vaccine. Our advice, they get the vaccine as soon as they can get their hands on it, or as soon as they find the opportunity to get the vaccine. And the vaccines we are getting in Nigeria, they are safe, they are effective. A couple of local studies that are being done, because the vaccine, almost everybody who is getting the vaccine in Nigeria is just getting the second dose within the last 2 weeks. So it's very premature or very early to say the effectiveness in our own population. But so far, so good. Little case studies that have been done have found that individuals who have collected the vaccine have a reduced chance of acquiring the virus, and those who do usually do not develop severe disease. So I would say the vaccines are safe, and the vaccines are the way to go. Just like everywhere in the world is opening up, Nigerians too should embrace the vaccine and, take it when they have the opportunity to.
We appreciate your time on the program. Thank you so much, Dr. Ajibola Sonda, a specialist physician. Thank you for joining us on the program.
Thank you for having me.
The primary healthcare development in Taraba State has lamented the insecurity challenges bedeviling some parts of the state, which is hindering success in the vaccination rollout. The Executive Secretary, Primary Healthcare Development Agency, Mr. Aminu Hassan, stated this in Jalingo, where he listed other challenges like difficult terrains, inaccessibility due to the nature of some communities that are hilly and riverine.
The most important challenges that we face during the exercise, as we already mentioned, is the difficult terrain of the state, security challenges across some pockets of some of the local governments, the inaccessibility nature of some local governments that are hilly and riverine areas. But be it as may be, the National Primary Care Development Agency is working assiduously to support the state with little funding in the area of logistics to complement what the state government is giving. But I want to assure the good people of Taraba State that the agency, in collaboration with the Ministry of Health, will continue to do its best to ensure that at least no person is left behind without taking the vaccines. But even as we continue to give the vaccination, I want to crave the indulgence of our people to continue to maintain the social distancing protocol, using the face masks, washing of their hands, so as to ensure that we protect ourselves and our loved ones.
We have more updates on the COVID-19 program when we return. Please stay with us. And public health officials in Germany are worried that the good summer weather and strong vaccination numbers can obscure the dangers that the coronavirus still poses. They're calling on all to avoid a repeat of the false sense of security in the summer of 2020. This is due to what has been referred to as the fast-spreading Delta COVID variant, which could have different symptoms. Well, for more on this, Deutsche Welle correspondent Rob Watts is with us now. Hello, Rob. How pervasive is the Delta variant in Germany?
Well, it is here, but for the moment, the number of cases is remaining at a low level. There have been fewer than 100 reported in each of the last 2 weeks. However, as overall coronavirus case numbers in Germany are falling, Delta is making up a growing percentage of those cases. For example, last week, it was making up 4% of cases in Germany. Now it's making up 6% cases nationwide. However, it makes up a bigger percentage in some German states and a much lower percentage in others. For example, in Bavaria, it's making up less than 1% of all of the coronavirus cases. But here in Berlin, around 9% of cases are the Delta variant. Despite those low percentages, though, it is now the second most prevalent variant in Germany.
In the UK, we're hearing 99% at the moment, but will it have any impact on the country's vaccine rollout and the easing of restrictions?
Well, that's something that politicians are having to grapple with. They're thinking back to the arrival of the Alpha variant at the start of the year and how quickly that went from being a very small percentage of cases to initiating a third coronavirus wave, and is by far the most prevalent variant here in Germany now. State and national leaders have got to balance that fear with their desire to get the economy going again, especially with elections coming up later this year. So far, there hasn't been talk of stalling the easing of restrictions as a result of the Delta variant, but it is being watched very closely. It's unfortunately, it's fortunately indeed arrived in the summer when people are outdoors a lot more, unlike the Alpha variant, which came over from the UK. And that came in the winter time when people are inside a lot. And it is easier to spread the virus indoors, of course. There is a lot of hope here that the Delta variant will not do the same as the Alpha did. I saw one German politician say that it's arrived too late to ruin the German summer.
Let's hope that. But finally, Rob, for the future, how big a threat is this Delta variant?
Well, there are dangers ahead relating to this variant. For example, with the easing of restrictions, Germans are heading off on holiday. A lot of their favourite destinations are sunny southern Europe, such as Spain and Portugal. These are also the favourites of the British tourists too, where the Delta variant is the majority variant. And there is concern that German tourists could mix with Brits and then bring the Delta variant back to Germany with them via this third country. Beyond the summer, there is something of a race against time to get as many people vaccinated as possible to avoid Delta taking hold when people start to move back indoors. Evidence suggests the vaccines that people are getting are still highly effective against Delta. So whether this more dangerous variant can be kept at bay is going to become clear in the coming weeks and in the coming months.
Quite a lot of things to consider. Many thanks there, Rob Watts, Deutsche Welle correspondent. Thanks again. Now, Israel will send at least 1 million soon-to-expire COVID-19 vaccine doses to the Palestinian Authority under a deal to share shots after being urged to do more to ensure Palestinian access to vaccinations as it's inoculated its own citizens at world-leading speed. Here's more of the global update.
Israel will send no less than 1 million COVID-19 vaccine doses to the Palestinian Authority under a deal to share shots. This will serve as a boost for the Palestinians' vaccination campaign in the occupied West Bank and Gaza, as around 55% of eligible Israelis are fully vaccinated, while just some 30% of eligible Palestinians in the region have received at least one vaccine dose. UK Prime Minister Boris Johnson says he is very confident about lifting the country's COVID-19 restrictions on July the 19th.
I'm very confident that we'll be able to go through with step 4 of the roadmap on the timetable that I've set out, with treating July the 19th, as I've said, as a terminus date. I think that's certainly what the data continues to indicate.
This comes just days after hundreds protested the possibility of an extension of lockdown measures. As the more infectious Delta variant continues to spread worldwide, Germany says it is a matter of when, not if, it will take over in the country. The president of Germany's Robert Koch has announced that they expect the Delta variant to become the most dominant by autumn.
Wie wir die Maßnahmen weiterhin umsetzen.
Just a day after her announcement to roll out coronavirus vaccine across the New Zealand, Prime Minister Jacinda Ardern receives her first shot of the Pfizer COVID-19 vaccine. The Pacific Island nation shut its borders and used tough lockdown measures to become one of the few countries to have virtually eliminated COVID-19 in the community. But the government is facing criticism for a slow rollout of vaccines.
Well, don't forget to adhere to the public health and safety measures as we continue to take responsibility. Visit our website for more updates, also a better understanding of the pandemic. It's channelstv.com. You can find other stories there as well in politics, business, sports. It's all at your fingertips. And that's the program for the week. Thank you for watching. I'm Millicent Wongoka. Stay safe.